name is Dr. Tinashe Magumise, the General Manager at VIVAT Health Solutions. Today we join the global community celebrating World Hepatitis Day in raising awareness on hepatitis. So speaking of hepatitis, in terms of definition, hepat means liver, itis is inflammation, so simply put, it is inflammation of the liver cells. The causes for hepatitis are drug abuse, alcohol abuse, as well as viruses. Speaking of the viruses, there are about 5 types, which is hepatitis A, hepatitis B, C, D, and E. And in terms of transmission of these viruses, hepatitis A and E, they are transmitted through what we refer to as fecal-oral route. That is ingesting or eating food or a drink that is contaminated with feces of an infected person. So after eating or drinking contaminated food or drink, you can get these viruses. So that actually speaks to unsafe water, inadequate sanitation, poor personal hygiene, and practices of oral anal sex that can lead to transmission of hepatitis A and hepatitis E. And then we go to hepatitis B, C, and D. These are transmitted through bodily fluids, so exchange of bodily fluids. So these ones can actually be transmitted through sexually transmitted routes, or those that do engage in pushing of drugs, IV drugs, as well as exchange of blood. That can actually lead to infection or transmission of hepatitis B, C, and D. And another most important way of transmission of these ones, again, is a mother to child. During childbirth, that transmission can happen. Looking at the signs and symptoms for hepatitis in general, all the forms of hepatitis, they have common, what we can refer to as common signs and symptoms. And these are general body malaise or weakness. You can actually have a fever, which can be low grade and not too high, as well as loss of appetite, nausea and vomiting, jaundice, and you can also experience itchiness of the body, as well as passing dark urine. But usually that happens when you have complications leading to deep jaundice. In terms of treatment, the commonest, especially in early stages, one just needs to take a rest and most of the symptoms can go by their own. But if the disease continues to progress, one may need drugs, and in this particular case, they are antiviral drugs, but this is mostly speaking for types B that can be treated using antiviral drugs, as well as injections or interferon injections if the conditions deteriorate. You can also have liver transplant, especially when the disease has progressed so badly. In terms of prevention, one needs to change their lifestyle, especially when we are looking at drug abuse and alcohol abuse. We need to reduce in those. And also, one can be vaccinated in order to prevent acquiring these viruses. Thank you.